How many eggs a woman can produce in a single cycle depends on a number of factors, but largely depends on her age. So a woman in her 20s would have no problem producing 14, 20 or more eggs in a single cycle. A woman in her 30s might produce about half that many, and a woman in her 40s half again or less. So the younger you are, the easier it is to obtain eggs. And generally, when you obtain your eggs, they're going to be in different stages of development. And the only ones that are really worthwhile freezing that will give you much use are those that are mature. And in a well-managed cycle, about 2/3 of the eggs that we obtain will be mature. As I said before, the woman in her 20s who produces 20 eggs might be able to freeze 12 to 16 of those eggs in that single setting, which brings up the question, so a young woman who produces 16 or 20 eggs or so, that may be sufficient to accomplish her goal. And so what is that goal? Well, the goal is to have eggs set aside so that in the future, when you're no longer 20-something, you'll still have high-quality eggs to come back to. And each of those eggs probably has a very good chance of being an embryo, and each of those embryos has an excellent chance of becoming a baby. On the average, the young person we're talking about, each embryo produced from those eggs might have about 50-60% chance of becoming a baby. So that would be very good. However, when you start talking about eggs from older people, those potentials are much less. So let's go to the other end of the spectrum and talk about somebody who is in their 40s. A woman in her 40s who has a single egg that becomes a single embryo, and it's a beautiful looking embryo, just as nice as the ones we were talking about from the 20-year-old, but simply because that embryo is now being produced from an egg that's from a 40-something-year-old, it only has about a fifth or less of the chance of becoming pregnant compared to the egg that's produced by the younger person, or even by the same person had she been younger. So maybe you could estimate a best case scenario in which the chance of a single embryo produced by a woman in her 40s might have a 5 or 10% chance of becoming a baby. Well, there's no number of eggs that you could freeze that would guarantee that you're going to achieve success, but you could say, how many eggs would I have to freeze to give me something like a 50% chance of achieving my goal if I'm freezing them when I'm 40 years old? And the bottom line is it's going to be a lot more than you would have used when you were when you were 20 or with a 20-year-old. Most people, because of the realities of how many eggs you can actually produce, would go with something like 20 eggs. But even those 20 eggs will not be anywhere near a guarantee of achieving a pregnancy. They're likely to give you a fair chance, but not a very high chance.